Welcome back to the Non-Traditional Veterinarian. And again, let's take a little bit of a non-traditional approach to a conversation. And that approach is going to be digging deeper into figuring out why things are happening for your pet. But you may be thinking, well, who is this a good fit for? Who are these visits a good fit for? What kind of tests are we going to do? And I have talked about these, I call them functional tests. I think about them in the sense of like a functional doctor. If this is the first time that you are watching a YouTube video of this channel or listening on Apple or listening on Spotify, I'm Dr. Bimonte. I've been a veterinarian for a little over 12 years, and I'm just so thankful that you are here and that you are curious and that maybe you are considering or you do think differently about your pet's care, or you want to start thinking differently about their care. I like to take a non-traditional approach. I like to have non-traditional conversations. I like to think outside the box because I believe no two pets are the same. And I feel like when your pet is having chronic poop issues, chronic allergies, chronic ear infections, repeated vet visits for the same thing, it is likely their body trying to get your attention, that their immune system is overreactive, their immune system is confused. And I think there's an opportunity here for us to support them. And so on this episode, I want to talk about who are these tests even good for? Who are tests maybe not good for? And when I'm talking about these tests, I'm talking about tests that I offer to my clients and patients to try and dig deeper, to try and get answers as to why something keeps happening, why you are at the vet repeatedly with the same prescription. And I, in fact, just recently had a vet visit with a very, very nice family, very sweet dog. And the husband was rightfully frustrated. He's like, this has been an issue for about 3 years and it's gotten really bad. And he's like, I'm frustrated because every time I go in and I tell them the medicine's not working and they just prescribe me the same medication. And he's like, I want to figure out why. And I'm like, I do too. That's where my brain goes. When there's something wrong with a pet, my first question is like, why? And sometimes we don't ever know. And sometimes things happen when we do everything right. I also think there comes a peace of mind at some point knowing, okay, I did everything I was supposed to do. I checked every box. And while sometimes that is still heartbreaking and frustrating, I think there comes a peace and a grace with that. That is like, but imagine what it would have been like had I not done all of this. And so I want to talk today about these functional tests, who they're a good fit for, maybe why you'd want to consider it. And so when I'm talking about these tests, I'm typically, most commonly, now no two pets are the same, so sometimes we take a different approach. I'm talking about testing the microbiome of the gut. We can test the microbiome of the ear or the urine. There's other things depending on what's going on with your pet. But of course, my mind, or even the mouth, and my mind is thinking, where's the gut at first? And I think that helps us get to the destination a little bit quicker. And what I mean by that is, yes, we could test the gut or the microbiome in the mouth and the ears, but I want to know what's going on in the gut because so much of the immune system is influenced there. Also, I'm thinking about tests, functional tests like screening for mold mycotoxin, so mold exposure. My functional doctor has done that for me. I'm thinking about glyphosate exposure, a common herbicide that just eats away at the gut microbiome, at the community of bacteria and yeast and fungi in your pet's gut. I'm thinking about heavy metal exposure screening. I'm thinking about screening them for food intolerances and sensitivities. And I really look at this as each of them is a piece of a puzzle, and you could pick just one, right? And maybe have an idea what that puzzle looks like depending on the piece and how big it is. But really to put the whole picture together, really all the information is really valuable. And I want to explain why and who these are good for. Because I've had a few cases lately that have thrown me a curveball, that have proven to me why more data is more important. And it's not that more is better. And I've said this before, it's better is better. And having this data allows that to happen. And so let's start with why I feel that collectively these are the best options out there rather than a la carting, and then who these are good for. So one is why I feel like a la carte in this situation doesn't really get us to the destination. I've been using this example lately. If you have not already picked up, I love analogies. I feel like it just helps really, like you can close your eyes and you can visualize it. So I don't know how many of you use the app Waze or even Google Maps for driving. Even though when I know how to get somewhere, I love using Waze because I like to know if there's traffic up ahead, if there's a diversion, if there's cops on the road. Hi, Dad, if you're listening to this, I don't ever speed. I was raised by a retired cop, so I don't ever speed. And I like doing that. And what's really cool about Waze, and I can't speak for every GPS option out there, but I can speak for Waze, it gives you options like no tolls, here's the quickest way, the fastest way, the shortest distance. And I don't know about you, but I want to optimize my driving when I'm going somewhere new. I'm like, how can I get there the quickest? What's the shortest distance? And if I can avoid tolls, great. And so when we do these a la carte tests, and I will be honest, and I will be transparent, and maybe your pet parent who's listening to this and be like, that was me, is that I used to explain all the tests and kind of tell my pet parents what I felt like it was a priority, but ultimately I was kind of giving them a decision in it. And looking back now, not that it was wrong, I feel like giving them the option to choose is not the best. And the reason for that is people are always going to choose what they feel like is the quickest way. And really the quickest way is get all the answers. And that is because I've had several pets, now about a half a dozen lately, that have really thrown me a curveball and have shown me that you need the whole picture. And the reason I'm saying this is I've had pets where they've had bad ears, bad skin. They've had something very, very obviously wrong that they are suffering with that is chronic, that the owners are frustrated. I'm like, I can't even imagine the poor pet. And they're like, I just want to do the intolerance and the gut screening. And I think that's a great solid foundation. And is it more than scratching the surface than just traditional blood work? Yes. But still, it is literally just a scratch on the surface versus like getting the shovel out and let's dig and let's figure out where these roots are. And that's because some of these pets that have had really significant things that they needed support with, it's very, very obvious, like as soon as you see them. And we just do the gut microbiome or just the microbiome, the intolerance test. And the microbiome is really not that exciting. I'm expecting to get a report where maybe the gut is overloaded with yeast or, there's a complete collapse of the gut microbiome, that the bacteria count is off and we don't have the right number of species. We don't have the right number of diversity. Things are just very out of whack. There's bad bacteria in the gut. The things where you're like, okay, on paper, this. And even then, even if I got that report, I'd be like, but why? Again, like, what's the history of this pet? How many rounds of medications have they been on, antibiotics and medications? And what are they eating? And what's their environment look like? But I've realized with some pets that I get these reports back and I'm like, how is the gut okay right now? Like, it's kind of more resilient than I was expecting. And that's where, again, we have to dig even deeper. And so I've learned from because it took me a while to get a report like that, where I'm like, okay, this does not match my patient on paper. And then let me throw you another curveball is on the pet parents where they were doing they're like, let's turn over every rock. Let's figure out what's going on. Is these pets are loaded with mold exposure. And they've got glyphosate in their system, and they've got heavy metals, and their gut is hanging on by a thread, a good thread, but a thread. And I'm like, I think it's only a matter of time before this gut collapses, and this gut is not resilient, and the immune system takes an even bigger dive. And I've seen that. And that is why now it has been restructured that there are packages, and depending on what your initial concern is, or your goal, or your expectations, that we make recommendations on the packages. What I would love is for everyone to do the top package. And then I have to tell myself that not everyone is that bought in yet, or not everyone is there financially, and that's okay because everyone's doing the best that they can. And that some information is better than none, but also, are we really going to be making strides? And lately, I've had a few pet parents that were like, oh, I'm going to do this package, and then we start talking, and I believe in as much transparency as possible, as much cognizant transparency as possible. Sometimes things slip our mind because we're like, didn't even think about that, didn't even think to discuss that. But being cognizant and aware to be transparent. And I tell pet parents, hey, I do want to be transparent. I think this is a great place to start with these 2 or 3 tests. I want you to know that it is likely going to be that at some point these other tests are going to be recommended, so we have the whole picture. Because I've learned from some of these pets that their microbiome has come back normal, or this test has come back with better expectations than we were expecting. And I'm like, hey, the next step is screening for X and Y. And then those are the tests that come back abnormal. Listen, I would love to walk in and grab my wand, pretend this is a wand, and bippity bop and be like, this is the test you need, this is the test you need, this is the test you don't need, this is normal. I would love to do that. If you're not watching on YouTube, I grabbed a spatula that, or a spoon that is actually from a communication sales course I took years and years and years ago about stirring the pot, get the juices going in the brain. And I would love to walk in and do that. That's just not the reality. And so it's not that I want to do tests just to do tests. It's that I think that getting data is really, really important. The more data we get, the more decisions we can make, and the more personalized decisions we can make for you and your pet. And how much peace of mind, though, to know. I think pet parents sometimes get frustrated when they're like, well, that test was normal. I paid for it. And it's like, okay, but the alternative was it not being normal and something being wrong with your pet. Also, we know what it's not. So we still may not know what it is, but we know what it's not. We know that's what's not driving it. And I think it's really, really valuable to have that information. And so I'm going to be honest with you. I sat at one point a little over a month ago. I was like, should I just make it an all or nothing package situation? And I was like, I also know that that's just not realistic for every pet and every pet owner. And I'm like, some information's better than none. But also now having these cases where the gut microbiome is relatively decent, but the pets, I'm like, okay, but their ears look horrendous. Like you can smell them as soon as you walk in. There's something deeper going on here. And that's where I'm like, I think it's well beyond just like a food sensitivity or a food allergy. I think there's toxins or exposure to things. And that's why I have learned that as much data we can get as possible is important. So who are these tests even a good fit for? Of course, the chronic ears, whether it's 1 ear or 2. Of course, the chronic poop issues. And when I say chronic, maybe it's all the time, or maybe you're like, we just never have normal poop. It's consistently inconsistent, or it's inconsistently consistent. If you have a pet with anal gland issues, and I have people come to me that their pets have all sorts of conditions, seizures, cancer, kidney disease, tumors that just keep popping up, urinary crystals, urinary tract infections. Oh my gosh. Of course, allergies, and anywhere from just being the paws to the whole body to, itchy butts to liver disease to, and I know I'm probably diabetes. And then I have a very, very, very small selection of pet parents that, hey, nothing is terribly wrong and I want to know. And so who are these tests a good fit for? Of course, they are a good fit. And I hate to overgeneralize, but I do think all of the tests, and also one of the other tests I left off was when I was mentioning them as vitamin D screening. In fact, if you do the top tier package, currently how it's structured is that you get a complimentary vitamin D screening. It's a blood test. It is complimentary. And it's something that I extend to you to do. It's something I still have to pay for. But I feel like if you are investing that much time and intention and money into your pet's care, hey, let's put a ribbon on it. Let's put some sprinkles. Let's put the bow on top. Let's check their vitamin D, because more than likely they're going to need support with that as well. And so really important with their immune health. And all of these tests are really valuable when you've got a pet who's got a chronic issue that you're like, it's driving me nuts if I have to go to the vet one more time for another ear infection, or if I have to go to the vet another time for them waking me up in the middle of the night scratching. Or you're a pet parent, you're like, yeah, the prescriptions work, and my dog's 4 years old and I don't want them on prescriptions for the rest of their life. Or, I'm someone who's really mindful of my lifestyle, and when I decide to put in and on my body and, a one-time thing, okay, but I don't want my pet on this long-term. I don't feel aligned with it. I think these options, these explorations, these tests are a great tool for us to figure out what can be driving it. What do they have? What are they exposed to? What's in their system? What's complicating their immune system? What's confusing their immune system? Also, on the flip side of that, these tests are just as valuable for a pet, quote unquote, that looks healthy. I've talked about my dog a lot on these podcasts where I tested him last November. I finally was like, all right, put your money where your mouth is and let's test your own dog. Your dog looks healthy. He's healthy. No medical conditions. Why am I waiting until disease is now dictating the conversation? I'm stressed. I'm panicked. I'm running a business. I'm practicing medicine. I'm managing patients. I'm doing all this and I'm not even screening my own dog. And I'm like, why are we waiting until pets get sick to get more information? Now is the time to get the information while they're still healthy or they look healthy. And you know what? Again, if this is the first episode you're hearing about this, I invite you to go back and look at these on like why I tested my dog for these things. And what I found, he had mold, no signs, didn't have any issues. But I know what was going to happen. Eventually, it was going to be an issue. Eventually, my dog was going to have allergies, quote unquote, out of nowhere, or something. All of a sudden now he's got abnormal poops or he's got ear infections. It was a matter of time until his immune system was like, you know what? I've had enough. I can't keep up with this. And so had I not done that, I think I would have been, what was the movie with Sandra Bullock and she had the blindfold on? I can't remember. I always reference it like in my personal life, but that's what I feel like it would have been like. I would have just been going through it blindly. Now, what I don't know is I don't know how it's going to change the outcome of his quality of life and his health span. I'd like to think it's going to better it. I've detoxed him and retesting him and feel confident. But what I do know is that would have been there regardless. And then if I would have been reaching for this at a time when something's wrong, I'm like, I wish I would have done this sooner. And so I did it when he looked healthy and found out that like, hey, he had stuff in his body that needed to go. He needed some support. And his gut was not bad, but it needed some support. And whether that was due to the mold, I don't know. And so who are these tests good for? I think they're good for, and I don't like to generalize, but I do think they're good for every pet. However, who I don't think they're good for on the same aspect is they're not for every pet. Because, and what I mean by that is they're not for every pet owner. You have to be prepared when we get data that it is going to be recommended to make decisions, that it is going to be recommended to take action, that it is going to maybe be, hey, let's support them and detox them, and here's things that we can do. And we may have a flare-up. Talked about it on previous podcasts. My dog never had ear infection his whole life. In fact, he just turned 9 in July 2026. Never had an ear infection. First ear infection, which in consideration of everything I've seen is mild. For him, it was significant because he'd never had one. While I was detoxing him, things got a little out of whack, but I was supporting him through it and he recovered just fine. So I tell pet parents, hey, it's possible that things may get a little bit worse as we detox. Things may flare up as the immune system is recalibrating. And that's what we're doing when we're supporting them with rectal ozone and fecal transplant material that is from screen donors and detoxing them. Like we're supporting that for them. We're supporting that immune system getting recalibrated. And so I don't think they're a good fit if you are questioning every little thing. And the reason, and not that I don't want you questioning and learning and leaning in, but if you're going to question every move out of disbelief, then you're not going to be bought in. And if you're not going to be bought in, I think it's best for you to save your time and money and me to save my time. And we don't do this. I don't think it's a good fit if you are not going to be bought in to the process. And don't do it just to feel like you did something, be like, well, I explored this other option. If you don't feel aligned. Recently, I had a pet parent at a visit, very, very nice. And she opted for the middle package, which I felt like was a really good starting point, and told her, hey, just so you're aware, so that way if this happens in a month from now or 3 months or 6 months, it's likely, I don't have a crystal ball, again, didn't have my wand with me, and that's a joke, is that it's very possible that I'm going to recommend these tests. It is possible. And what I don't want you to do is be like, why didn't I just do them? Why wasn't I offered this? Here you go. And she was like, I still just want to do this and I'll decide. I said, totally understand that. And she kept asking, well, are these tests going to give us answers and it's going to stop the itching? Like, I don't know. What it's going to do is give us data and hopefully we can get closer to figure out what's driving this so we can stop what's driving it and help support the itching. I'm never going to say your dog's never going to itch again or never going to have a skin infection. My hope is can we eradicate it or minimize it where it's way less frequent at certain times of the year and we know how to support them because we figured out what's driving it. But it's not like these tests are one and done. It's not like the treatment is one and done. And also, I'm like, I can't guarantee your compliance. I can't guarantee that you're going to be consistent with giving things you're supposed to and making changes and your household. I don't know every little thing, like what detergents you're using and fragrances they're exposed to that are artificial and other chemicals and how your lawns being treated. I mean, there's a lot of factors in there. So I'm like, I can't guarantee it because I can't control every variable. What I can guarantee is that if we do this and we get data, we are going to make decisions to help get closer to that. And there is going to be some responsibility and compliance on your part. And sometimes we do everything and things, there's hiccups. I have pets that they're doing beautiful on the fecal supportive care, and when we stop, they regress a little bit. And that tells me, even though on paper maybe they look good, that their system needs a little bit more support. I think it's really important that we look at what's on the paper and we also look at the patient. We don't just look at one and not the other. We look at it collectively, and the pet owner, you as well. But that's who it's not good for. If you're going to question every little recommendation and not and help me understand so I know going forward for my next pet or what to look for. But if you say you're on it and then you're questioning the validity, you're questioning this, or because the test results don't come out the way that you've wanted it to, and now you're questioning it, it's not a good fit. And when I mean questioning it, that you're now like backtracking. I don't know what answers we're gonna get. If I knew, again, I would be like, here's just what we're gonna do. And so I also do feel like they're a good fit for even pets that are healthy, because I think that it can be very misleading that your pet can be very healthy on the outside and they're not. Because how many times have you said it, and I hear it all the time, every single week, if not almost every single day, I don't understand why this is happening. I don't know what caused this. We were fine up until blank. That's almost always how it is. Always. And so I do think it's an opportunity for us to get ahead of the curveball and figure out where they are so that we can support them the best way, because we have the data to support them, rather than just taking a guess and putting a blindfold on and walking around and hoping for the best. I can't wait to see you on the next episode.